Hurricanes wield a profound and multifaceted impact on human health, encompassing both immediate and enduring consequences. As these ferocious natural disasters unleash their destructive forces, ranging from powerful winds and torrential rainfall to devastating floods, a cascade of health challenges follows suit, affecting individuals and communities in myriad ways. The most direct and visible health impacts of hurricanes are often physical injuries and fatalities. Collapsed buildings, flying debris, and drowning incidents are common hazards during the storm's peak. These immediate dangers result in injuries that can range from minor to life-threatening, overwhelming medical facilities and first responders. The loss of lives and injuries can shatter families and communities, leaving lasting emotional scars and psychological trauma. Post-storm, the aftermath can bring forth insidious health threats that emerge from compromised water sources and disrupted sanitation systems. Contaminated floodwaters, tainted with sewage and pollutants, pose a significant risk of waterborne diseases. Cholera, dysentery, and other gastrointestinal infections can spread rapidly due to inadequate access to clean water and sanitation facilities. Vulnerable populations, such as children, the elderly, and those with pre-existing health conditions, bear the brunt of these risks. The collapse or severe damage of healthcare infrastructure during hurricanes exacerbates health vulnerabilities. Hospitals and clinics may be inoperable, medical supplies may be scarce, and access to necessary medications can be disrupted. This scenario is especially perilous for individuals with chronic illnesses who depend on regular medical care and prescriptions. Pregnant individuals, too, face heightened risks due to limited access to prenatal care and safe delivery options. The mental health toll in the aftermath of a hurricane is often underestimated. Survivors grapple not only with the physical aftermath but also with the emotional scars of loss, displacement, and trauma. Post-traumatic stress disorder, PTSD, depression, and anxiety can become widespread among survivors as they cope with the upheaval of their lives and uncertainty about the future. This is exacerbated by disrupted social networks, economic instability, and the sense of loss of normalcy. Respiratory health issues also surface as a long-term consequence of hurricanes. Water damage to homes and buildings can foster the growth of mold, releasing spores that degrade indoor air quality. These spores can exacerbate respiratory conditions such as asthma and allergies, posing a continued health risk for those exposed. The lack of resources and proper infrastructure to address mold-related health concerns compounds the challenge. Moreover, hurricanes often disrupt communication networks, impeding emergency response coordination and the timely dissemination of crucial health information. This can lead to difficulties in organizing evacuations and coordinating medical services. The strain on healthcare systems in the aftermath of a hurricane can result in delayed or inadequate medical attention for those in need. To effectively mitigate these health impacts, comprehensive preparedness and response strategies are imperative. Disaster planning should prioritize the specific needs of vulnerable populations, including the provision of medical care, essential medications, and mental health support. Public health campaigns must emphasize safe water practices and proper hygiene to prevent disease outbreaks. Long-term recovery efforts should focus on rebuilding communities with improved infrastructure, resilient healthcare systems, and accessible mental health resources. In conclusion, the ramifications of hurricanes on human health are intricate and far-reaching. Beyond the immediate dangers of physical injuries and fatalities, the aftermath brings forth a spectrum of health challenges including waterborne diseases, disrupted healthcare, mental health struggles, and respiratory problems. Addressing these multifaceted health impacts necessitates a holistic approach that integrates medical, public health, and mental health interventions. By doing so, communities can be better equipped to navigate the arduous path to recovery and build resilience against future storms.